This one very similar to you know, the lower carb diet, but not something typically that's, you know, incredibly probably helpful. If patients come in, they tell you they've been on that diet, you'll know what that is. It's basically just a lower carb diet with increasing amounts of carbs as time went on. The zone diet. Now, this diet is one that was developed by Barry Sears. This is one that is more helpful for athletes. And so if you look at this macronutrient composition at the top, what you'll see is that it's a little bit higher in carbs than what we've been talking about. But the amount of carbs that patients need is highly tied to activity levels. And so patients that are athletes or have a lot more activity are going to have increasing needs for carbs. And he does this you know, very balanced macronutrient composition, very moderate calorie intake per day, and he talks a lot about what he does, which you know, we talk about not only in this course but in the anti-aging course as well, about, you know, decreasing inflammation and promoting health and a healthy metabolism at the same time that we're helping patients lose weight. And so a lot of what he's written, what he's done with this diet, talks about some of the concepts that we've already talked about, but lowering insulin being very important, keeping a nice healthy anti-inflammatory balance in the body, being very, very healthy. And so again, for patients you have that may be athletes but heavier than they would like to be and needing to decrease weight and doing more rigorous training programs, you don't want to put those patients on a really low carb or ketosis protocol for the reason we talked about, because the mechanism of action of that is going to be depleting glycogen. And so this would keep those patients in a healthier place.